Namaste. Welcome to your prenatal asana series. We are practicing Janufalak Akarshana or Kneecap contraction. This asana is safe for practicing during all trimesters, except in the conditions where there is specific knee pain or there is some injury has happened on the knees or any surgeries on the knees at any point in time in the past. In those cases, this should not be suggested. Otherwise, it's absolutely safe in all trimester during all times. And it is having a lot of benefits for the legs because women can get a lot of leg cramps during the prenatal phase, and there can also be fluid retention in the legs. So this helps prevent and relieve that. This helps strengthening the knees because the weight of the belly can give a lot of stress on the knee joints, and helping relieve that stress is very important. So this asana helps with that. This also helps relaxing the overall legs and stretches the muscles of the inner thighs. So the way we practice this is we come into one straight line. We relax on our hands and we begin to, as we inhale, push our knee downwards on the floor and kind of upwards towards the thigh. So we inhale and exhale, release them. Inhale, contract the knees, exhale and release them. Inhale, contract the knees, exhale and release them. Inhale, contract the knees, taking them downwards and slightly bringing them upwards towards the thigh, and exhale. Practicing this 10 to 15 times is a very good practice for strengthening the knees, relieving the knee joints of the overburden, and release. So it's a relaxing asana. One can suggest this during any stage of pregnancy. There can be conditions where women can consult you in stages where they're not able to perform many asanas, where they have been suggested with bed rest, and due to their typical conditions like placenta previa or overfluid, or they have had previous miscarriage history, or they have cervical stitch, any of those conditions where women can be suggested by the doctors not to exercise much or not to move much or take absolute bed rest. In such condition also, if there are bare minimum asanas that you can suggest, then Janufalak is one of them. And there are other movements like Hastasanchalan or gentle arm movements. There are many other asanas which just require you to even sit on the bed and practice this. This way, at least the blood will flow in the body and there'll be slight movement that will keep happening in the body without making body dysfunctional during the prenatal phase. So you should always have slight tools and slight asanas in hand, which can be suggestive even in the worst case scenarios of the prenatal phase. Thank you. Namaste.